Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts, we're going to talk about fillers. Now, filler comes in a variety of different forms. Today, I'm just going to specifically focus on the hyaluronic acid type of fillers. Short is HA. So these are your workhorse fillers that you've heard all over the place. This is the Juvederms and the Restylans, and I don't want to have any brand specificness here, but suffice it to say, those are all filler products that are made out of hyaluronic acid. HA is a naturally occurring molecule in all of our skin, and it pulls liquid and fluid in, and that's what gives you that kind of plump, happy texture. The filler, the way it works, is it's actually an injectable gel or implant in that it kind of just gets shot in through a needle or a cannula, and then it actually sits there occupying space. And additionally, it will also pull water into it. This is why in the first few days, you might have some increased swelling before the look kind of settles down. I tend to tell my patients that if you leave the office feeling a little bit frightened and kind of worried about how swollen you look, you'll actually be really happy with the results afterward. However, if you leave the office and you're really happy, chances are you're gonna come back and you're gonna want more. And that's because you start seeing some of that swelling right away. Now, the other thing about filler is because it is an implant, it's a physical solid form, it is at risk for things like infection and vascular occlusions. We can talk about all these some other times, but the main thing to know is that this is something different from Botox or other toxins because it is something you should see in the office right away. And because it's an implant, it essentially just sits there and stays there. And so you should have a nice long time with it. Now we're gonna do a little demo real quick. I happen to have a syringe of filler right here. And this is expired, so we can't use it on anyone anyway. And I'm not showing any kind of brand loyalty. This just happens to be the one that I have. And I'm gonna show you approximately what one syringe of this looks like, because people always want to know how much is one syringe of filler really. So I have a handy dandy mirror. I'm going to try to put this on my cheek. Oh, it's very cool. Okay, so there's one thread. There's another one. Oh, this is pretty nice. Okay, this is a lot harder to do backwards because this is my non-dominant side, as you can kind of see. So I'm kind of putting and feathering these thin strands just so you can kind of see what they look like. Hopefully you can see it is actually a substance. It's actually just sitting there, which is kind of cool. But that was a whole syringe. And so you can see this is what it looks like. It's actually not that much volume-wise. And you can see that even with these 4 or 5-ish threads I've done, it's barely even a millimeter of extra volume, and that's one syringe, both cheeks. So you can see how you can really run away with filler and it can still look pretty natural, even though I know we're all scared of that kind of overdone look. Now we're gonna show you on a spoon, a simple spoon. This is a dinner spoon, so you can see how much one syringe of filler is. Okay, so here's our simple dinner spoon, and here is one syringe, one full syringe. You can see 1 milliliter of filler, expired filler. I'm just gonna show you how much is actually in here. I will say it does look like a lot when it's just sitting here in one place, but you can see in the earlier picture of me that when you spread this out throughout the face, it's really not that much. The last thing I'm gonna show you is how it's actually a gel. It's this kind of gooey consistency. So this is why it is soft, it's a little bit moldable, and it's great to mimic some of your normal tissue. So cool things too is I've now had this on my face for maybe about 10 minutes, and you can see none of it has fallen or dripped anywhere. It shows you that this is actually a gel and it's not just liquid that would kind of pour down my face. Now, different fillers do have different properties, but this is kind of a general basic thing that most fillers can do. So this is Dr. Lexie Wang at West End Plastic Surgery in Washington, D.C., and that was this episode of Face the Facts.